So what have we learnt in the remedy Dioscorea Villosa? We've actually done this remedy majorly from Dr. N.M. Chaudhary's Materia Medica, but we have also added some important points from Dr. Fatak's and Dr. Clark's Materia Medica, and also from Dr. Borik's Materia Medica whenever and wherever they felt very important, right? And now, what did we learn? So, Dr. N.M. Chaudhary told us the first thing that he told us was first that it is a perennial creeper and all that. It grows in South America, southern states of actually North America, and also we've seen that it is a great painkiller, and anodyne is what he calls it, and it is even more so than opium, and morphine is what we first saw, and we all were actually I hope we all are now convinced about it, because he's written so much about it in the due course of the remedy. Then we saw that the pain of this remedy is actually neuralgic in character, and that's why we cannot just very nicely say why it is starting here and why is it going there or nothing like that. Then we also saw about the sphere of action, which was on the solar plexus, right? On the solar plexus and on the spinal nerves, actually. On the spinal nerves. On the solar plexus, on the spinal nerves, you also saw that they acted on the ganglionic nervous system, and which was in the umbilical region. Hence, the whole of the abdomen and the nerves that are involved there are involved in Dioscorea. Nerves that are there are involved in Dioscorea. Along with that, Dr. Fatak also added that the nerve of the sciatic, like the sciatic nerve, is also involved. The spinal cord is also involved, and Dr. Borik also added that there can be any kind of abdominal or pelvic colic that you see in this remedy, since the viscera over there can be affected. Then we also saw that there Dr. Burt has told us that the pathology that you might see is necrosis of the bowels and of the stomach, right? And this actually stimulates the nerves, causing great hyperesthesia of those nerves, right? And hence the pain and the whole situation, spasm, becomes very, very unbearable for the patient. The pain is such that it is intense, it is cutting, twisting. Cutting is a very important thing, because it is seen again and again, even in the rubrics it is seen. So the type of pain is cutting in these patients, and it is twisting. So twisting is actually a sensation that they have. So this sensation, you see how they feel is as if somebody has clutched the intestines and they're kind of twisting it. So the pain is very, very bad. It's very bad. Okay, as if they're being twisted mercilessly is something that they feel. So the pain is excruciating. And the pain is shifting in character, or you can also say that it is radiating. So it radiates all over the abdomen. So from here it is starting, suppose, and it will radiate all over the abdomen. And not just all over the abdomen, but it might also shift to a distant locality, which can be fingers, toes, as we've seen also in the dysmenorrhea of this remedy, right? Then we've seen that there is shuddering due to this excruciating pain. And then we talked about a case which was very beautifully explained by Dr. N.M. Chaudhary. We could actually visualize because he has written it so beautifully. And then we saw a few more symptoms about it, like there were eructations, there is hiccups, flatus ameliorates the patient, even eructations ameliorate the patient, and liver is also involved. And in liver we saw that there can be gallbladder colic in these patients also, and the pain extends to chest, back and arms and all of that, right? And even we talked about the piles, which were like a bunch of cherries. Then we talked about the very important modalities, which were that bending or doubling up aggravated the pain. You can see it from his expression. And stretching out or bending back ameliorated the pain. So the patient is happy when he's doing that. Okay, even heart pressure ameliorated him. Going out for a walk in open air ameliorated him. Standing erect is making them feel better. Tea is aggravating, eating is aggravating, and this is aggravating, right? Yeah. Then we talked about something that we just now all that we've talked about until this part was about the abdominal pains, right? So now Dr. Fatak also tells us that it's not just about abdominal pains in this remedy, but it's about any kind of any region and this same kind of pain. if you see the same kind of pain in any region, you can think of this remedy. So if the even if the renal organs are involved, if the kidneys are involved, and then also if the same kind of pain is there, you can think of this remedy. And what happens in kidney is that the pain radiates from a small spot over the crest of the right ilium to the renal region, and then to the right leg and into the right testicle. So you see the right side is more involved. Even the sciatica was right sided, and even this pains are right sided. Okay, and then we talked about the paroxysmal kind of pain that Dr. Clark also mentions, and finally we talked about the angina pectoris. So all the painful conditions we have kind of seen in this remedy. So angina pectoris can be there. They can have violent dysmenorrhea, and in all the situations we saw that the pain's character remained the same. We can have sciatica, and in sciatica we have seen a few modalities also. That is, aggravation was from motion and from sitting, and amelioration was by standing on toes, which is little bit different. So standing on toes, and also by lying still. And again, it was on right side, and there was also burning and numbness involved, right? So this is a quick revision of what we have already done just now, right? And these pictures should help us remember all of these symptoms forever, is what I have tried to do. So that's about it today. Thank you so much.